Fellow Nigerians and friends around the world, good day to you all. Under His Excellency, President Bola Ahmed Tinubu GCFR, the Nigerian health sector is being built on a foundation of resilience as well as agility. In a world where local emerging and re-emerging infectious diseases can rapidly turn global, the federal government of Nigeria is working hard to prepare our national institutions and our health professionals and scientists. This informed our resolve to reposition the Nigeria Center for Disease Control, NCDC, to be a preeminent reference point on our continent and globally for disease surveillance, prevention, preparedness, and response. The leadership of our president has produced a number of important breakthroughs that promise to enable our country to most effectively prevent or respond to any new or recurrent public health emergencies. Recently, we launched the National Genomic Surveillance Strategy and the Nigeria Genomics Consortium. This is crucial because genomic technology will revolutionize the way we detect, monitor, and respond to infectious diseases. Globally, antimicrobial resistance, a mechanism through which microorganisms mutate and evolved to resist the effects of antibiotics designed to kill them, has attracted rapt global attention because of the wide-ranging impact of the phenomena on public health and health outcomes and, in fact, the economy more broadly. As the host nation of the 5th Global Ministerial High-Level Conference on Antimicrobial Resistance, which is holding next year, 2026 in Abuja, Nigeria has taken a lead in integrating genomics into our AMR surveillance systems, thereby enhancing our ability to track pathogens, anticipate future health threats, and advance precision medicine and efficient public health interventions. While we acknowledge that support from various mechanisms globally can be essential in financing these efforts and ensuring that Nigeria is equipped to combat antimicrobial resistance effectively, we still take full responsibility for the mobilization of as much domestic resources to protect Africa's largest population and to stay perpetually ahead of the curve. And this we are doing. The federal government of Nigeria, through the Nigeria Center on Disease Control, led its by Director General Dr. Jude Idris, has already commissioned the Integrated Disease Reference Laboratory in Lagos for neglected tropical diseases, malaria, fungal diseases, and others. The NCDC has expanded diagnostic access with new Mpox and Lassa fever labs, optimized existing laboratories in 13 states, all while reducing the turnaround time for outbreak confirmation and case classifications down to 24 to 48 hours because of an effective interstate transportation system and network. Having achieved the globally reputed ISO 15189 accreditation for the National Reference Laboratory and a 5-star rating for the Central Public Health Laboratory, Nigeria, through the NCDC, has developed a laboratory data management system which shows the dashboard of specific epidemic-prone diseases for immediate notification as well as strains identification. Disease surveillance and response would be entirely untenable without institutional coherence between federal and state entities in the sector. And this is why the NCDC operates effectively within the sector-wide approach framework of our ministry. This has facilitated the NCDC's institutionalization of monthly state surveillance and outbreak review meetings to support timely outbreak analytics and system improvement actions. The framework has been recognized by the World Health Organization as a global model for early action review based on implementation evidence that has been generated here in Nigeria. Furthermore, our NCDC has operationalized the Nigeria Preparedness and Readiness Alert System, NPRAS, a predictive risk-based platform for decision-making while conducting structured risk assessments already in 8 vulnerable states to inform subnational hazard profiles and achieve alignment. In terms of outbreak preparedness, under the President's leadership, the NCDC has recalibrated fully the distribution of consumables and medical countermeasures across all the 36 states and the FCT before epidemics get out of hand, and using our existing epidemic calendar system. With our teams having been thoroughly tested during real-time coordinated responses to outbreaks such as Lassa fever, cholera, diphtheria, and others, we have assessed the effective deployment of the National Rapid Response Teams to 15 states, even as we have so far trained 272 emergency responders in simulation-based trainings. The NCDC, under the coordination of our ministry, is not resting on its laurels. We're preparing Nigeria's dedicated group of outbreak responders with advanced training, and I am pleased to report that we have delivered 4 cohorts of public health emergency management intermediate courses training for over 100 responders. In fact, over 325 infection prevention and control focal persons from 95 tertiary hospitals 214 secondary facilities and 16 private, faith-based and armed force institutions are currently undergoing structured training to become certified IPC professionals. This represents a significant boost to Nigeria's health security workforce. Our nation has successfully developed its own standardized IPC training curricula and conducted cascaded trainings using a train-the-trainer approach. This ensures sustainability and scale-up at facility levels. Nigeria's joint external evaluation score improved, as we know, from 39% in 2017 to 54% in 2023 and continued to improve, reflecting enhanced security preparedness even as we lead quarterly reviews of our annual operational plans, as well as deploying the dashboard to monitor progress. Taken together, all of this represents our commitments to uphold, Mr. President, compact with you, the Nigerian people, and to the friends of Nigeria in our continent and other places, to reform our national institutions, to be proactive, to focus on merit, and have good processes in the way we deliver services, so as to protect our people today and our neighbors and the global community. But it also envisions and prepares for the unknown adversities that may come tomorrow. Our public health system is being strengthened, repositioned, and equipped for a 21st century that is certain to continue ushering various levels of globalized health threats and emergencies, which our nation at all levels of the government will be prepared for to take actions. And this is what we are doing today. Thank you, and God bless the Federal Republic of Nigeria.